Another day, another story. Public policy. Learn about the formulation and implementation of public policies in India, their impact on society, and the challenges in policymaking. Introduction. Public policy refers to the actions and decisions taken by the government to address public issues and promote the welfare of its citizens. Public policies are formulated and implemented by various government bodies and institutions, including the central government, state governments, and local authorities. Public policies in India have a significant impact on society, affecting various aspects such as health, education, environment, and economic development. However, the formulation and implementation of public policies in India is a complex and challenging process, requiring the involvement of various stakeholders and a deep understanding of the country's social, economic, and political context. Policy formulation in India. The process of policy formulation in India involves several steps, including problem identification, agenda setting, policy formulation, and policy adoption. Policy formulation is carried out by various government departments, committees, and expert groups, which provide inputs and recommendations to the decision makers. Problem identification. Policy formulation in India often begins with the identification of a problem or issue that requires attention. This may be done through research, analysis of data, or public consultation. The identification of problems is often influenced by political priorities, media attention, and public opinion. Agenda setting. Once a problem is identified, it must be placed on the policy agenda. Agenda setting involves the selection of issues that will be prioritized by the government. The agenda is influenced by political priorities, public opinion, and the media. Policy formulation. Once an issue is on the agenda, policy formulation begins. This involves the development of policy options that are designed to address the identified problem. Policy formulation is often carried out by expert committees or task forces, who research and analyze the issue and provide recommendations to the decision makers. Policy formulation is influenced by a variety of factors, including political ideology, economic considerations, and social norms. Policy adoption. Once policy options have been developed, they must be adopted by the decision makers. Policy adoption involves the selection of a policy option that is deemed to be the most appropriate and effective in addressing the identified problem. Policy adoption is influenced by political considerations, stakeholder feedback, and the availability of resources. Policy implementation in India. The implementation of public policies in India is often characterized by challenges such as inadequate resources, bureaucratic red tape, and corruption. The effective implementation of policies requires a coordinated effort between the government, civil society, and private sector actors. Resource constraints. The implementation of policies in India is often hindered by resource constraints, such as limited financial resources, personnel, and infrastructure. These constraints can limit the government's ability to implement policies effectively. Bureaucratic hurdles, such as complex procedures and bureaucratic red tape, can also hinder the effective implementation of policies. These hurdles can delay or obstruct the implementation process, leading to a lack of progress in achieving policy objectives. Corruption is another major challenge in policy implementation in India. Corruption can undermine the effectiveness of policies, as resources are siphoned off and diverted away from their intended purpose. Corruption can also erode public trust in government institutions, making it more difficult to implement policies effectively. Coordination challenges. Effective policy implementation requires coordination and collaboration between different stakeholders, including the government, civil society, and private sector actors. However, coordination challenges, such as a lack of communication and cooperation between different actors, can hinder the effective implementation of policies. Impact of public policies in India. Public policies in India have a significant impact on society, affecting various aspects such as health, education, environment, and economic development. The impact of public policies in India can be seen in several key areas. Health. Public policies in India have had a significant impact on improving public health outcomes. The government has implemented policies to address health issues such as malnutrition, maternal and child health, and infectious diseases. For example, The National Health Mission has helped to improve maternal and child health outcomes by providing access to essential health services and promoting healthy practices. Education. Public policies in India have also played a significant role in promoting education and literacy. The government has implemented policies to improve access to education, particularly for marginalized communities. For example, the Sarva Shiksha Abhiyan has helped to improve access to education for children from disadvantaged backgrounds. Environment. Public policies in India have also had a significant impact on the environment. The government has implemented policies to address environmental issues such as air pollution, water pollution, and deforestation. For example, the National Clean Air Program aims to reduce air pollution levels in Indian cities by implementing measures such as vehicle emission standards and promoting cleaner technologies. Economic development. Public policies in India have also played a critical role in promoting economic development. The government has implemented policies to promote entrepreneurship, innovation, and job creation. For example, the Startup India program aims to promote entrepreneurship by providing funding and support to startups and small businesses. Challenges in public policy making in India. The process of public policy making in India is complex and challenging, and there are several key challenges that policymakers face. Political fragmentation. Political fragmentation is a significant challenge in public policy making in India. With multiple political parties and coalition governments, it can be challenging to build consensus and implement policies effectively. Political fragmentation can lead to policy paralysis and a lack of progress in addressing public issues. Capacity constraints. Capacity constraints are another significant challenge in public policy making in India. The government may lack the necessary personnel, skills, and infrastructure to formulate and implement policies effectively. This can lead to delays and inefficiencies in the policy-making process. Limited stakeholder engagement. Limited stakeholder engagement is another challenge in public policy-making in India. The government may not engage effectively with civil society organizations, private sector actors, and other stakeholders, which can lead to a lack of buy-in and support for policies. Conclusion. Public policy making in India is a complex and challenging process that requires the involvement of various stakeholders and a deep understanding of the country's social, economic, and political context. Despite the challenges, public policies in India have had a significant impact on society, affecting various aspects such as health, education, environment, and economic development. The effective formulation and implementation of public policies in India will require continued efforts to overcome the challenges faced and foster greater collaboration and engagement between stakeholders. Thanks for watching.